lives lost by suicide in 2023 reached nearly 50,000 people. In that same year, suicide deaths in the construction industry increased by 2,000 people. These alarming statistics highlight a broader mental health crisis where many individuals struggle to receive the help they need. The AASHTO annual meeting session, Beyond Blueprints, Addressing Mental Health and Substance Misuse in Construction Workforce Safety, shined a spotlight on the intersection of mental health, suicide prevention, and opioid misuse within the construction industry. Sponsored by RS&H, a national architecture, engineering, and consulting firm, the session focused on increasing awareness of the growing challenges faced by workers in the construction industry. RS&H Senior Vice President and former Federal Highway Administration Executive Director Tom Everett discussed how the transportation industry can tackle these challenges.
Mental health and just raising awareness of mental health has been a priority of mine. And it doesn't matter if it's in government offices, consultant offices, or on construction projects. And our focus today is clearly on the construction side of things. But to me, it's really an epidemic, and it applies in any work environment, office, or field.
For Brandon Anderson, Vice President of Safety for the Missouri chapter of the Associated General Contractors, this topic is personal. A survivor himself, he highlighted the dramatic increase in construction worker suicides from 5,000 in 2022 to 7,000 in 2023, far outpacing the 1,000 people who were tragically killed on construction site incidents.
We're averaging about 15 to 16 per 100,000. You can see the rates here for construction. Unsustainable. And the largest demographic that we are losing as far as age is late 30s into the late 40s, early 50s. So the idea that it's these kids, the young folks of today in the workforce that we're losing at a higher rate is not accurate. It is the 15 to 20 plus year veterans in the industry that we are losing at the highest rate to suicide.
Michigan DOT Chief Operations Officer Greg Brunner underscored why his state is working hard toward the goal of 0 deaths, highlighting that increasing mental health services and resources plays a critical role in achieving that target.
And so we come to work every day to make a difference. And so at the end of my career, if I've saved 1 million lives, that'd be great. If I saved 1,000 lives, that would be fantastic. But if I saved 1 life, I could say I made a difference.
Representing academia, Dr. Mohammed Mahaney, an associate professor at Colorado State University, announced that researchers are surveying every state DOT on available mental health and substance abuse resources. They plan to release a report detailing each state's efforts.
Hopefully we'll continue that research journey to make this better throughout with wonderful people like this and people like you who are trying to also promote that and make people aware of it and implement programs in their DOTs. So hopefully we'll get more and more progress in that.
Richard Jones, Chief Clinical Officer for U-Turn Health, called for more action and training. He stated that mental health and substance abuse issues have a 70% remission rate if individuals stay engaged in treatment for 6 months to a year.
I'm excited though because the construction industry and the trades, organizations like AASHTO are, in my opinion, talking more openly about it. And I'm here because I can't stand watching people die anymore. These issues are very treatable, and we need to find new ways to interact, and we need to find new approaches, and we got to drive these numbers down.
Even as the stigma around mental health begins to lessen, the time to take action is now.
Over the next few years, you're going to start hearing work-life balance, exercise, eating right is what comes to mind for many of them, and so on when it comes to mental health versus the perceived negative aspect of it for prior generations. So there is a generational change is occurring, but we can't necessarily wait for that.